African American FUE hair transplant to restore hairline. This is our topic today. Our patient is a gentleman who is going to receive 1600 FUE grafts to restore a receded corner and a temporal point that is flattened. So patients sometimes come to just restore the hairline. Sometimes they have more advanced hair loss. In this case, he does not have any family pattern of hair loss, meaning that he doesn't lose a lot of his hair, just his hairline is limited to the corners and temporal points. And also, in microscopic evaluation, we don't see any evidence of future hair loss. So we can be more aggressive. We can give him a perfect straight hairline that he wants. Most African American want or can have a straight hairline. Caucasian should not have a straight hairline. They should have some matured hairline. For African Americans, we can make it a little more straight, more perfect as they can naturally have. This is patient before the procedure. I just designed the hairline. As you can see, the corners are going back, the temporal points are receded. Let's look at it from different angles. Temporal points are kind of going all the way back, flattening with the sideburns. The other side, the same thing. When we do temporal points, we have to make sure that we cover the area behind it too, not just the receded area, because the hair that's transplanted is thick hair. We don't want to have a bunch of thick hair sitting in front of the thinner hair. And this is from different angles. Ready for these?
Yes, I am.
Okay, we're going to go over your hairline. Okay?
Yes.
So let's just focus here. This is the area that we're trying to restore. So the corners are going back naturally. Genetically, he has this gene that they lose only the corners. The top, he doesn't have much miniaturization. With microscope, we don't see any evidence of future hair loss, so we don't have to worry about preserving hair for future hair loss. So this is the only place. And the temporal points, as you can see, temporal points, instead of being pointy forward, it's going all the way back and straightened with the sideburn. So we're going to restore that. Not only that, as you can see here, the sides are not as dense as the back. So when we bring better quality hair, we're going to put some hair on the back of this too. So everything's going to be nice and even and looks more natural.
49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 159. 1, 2, 3, 4, 5, 6, 7, 8, 2, 3, 4, 5.
African American hair extraction is one of the most difficult extractions in FUE. So you have to know what you're doing. So doctors should do enough African Americans to know how to extract them. So the angle that we see here, external angle, is very deceiving. The angle of hair changes in size. It becomes like a C. So what we see here, we don't even start with that angle. We start with a different angle, and then we turn it as we go in. So see how my punch is changing direction as it goes in. So I feel it. I know how to follow the curvature of the graft. Becoming a very nice thing. These grafts are looking good. See the angle of here. See how it looks like a C, some of them. So we have to follow those angles. The graft extraction is going well, although curly hair is a lot more challenging. But when we spend our time and learn the angles and exit angle and bend angle and everything, makes it much easier. Grafts are looking really good. Thick hair, curly hair, can have a great result. Okay, looking at the final look. The temporal points, good density. It's going to be nice and pronounced, and then the corners on both sides, and the other temporal points.